My daughter is 13. Her name is Samantha. She was born with a chromosome deletion. So she falls under the cerebral palsy umbrella. So she doesn't walk, she doesn't talk, she's fully dependent. She's tooth fed, we have seizures, we ride horses for therapy. So I also am familiar with being on the other side of the desk. I have the unique experience of being on either side of the desk, so I know the frustration and, oh God, we got some more paperwork to fill out, and you know, that whole thing. But I also deal with therapists and teachers and Medicaid and SSI and all of it. So I can understand some of the pain we're going through. So who all has a child in the autism spectrum? Okay, and then we have others that are not. Okay, good. Then I'm not as much of an expert on the autism stuff, but I can help you get through this. Different kinds of Medicaid. You have Our Kids, which is the easiest if you're income eligible. And Our Kids will count the parent's income. Usually if you're eligible for Our Kids, you could get SSI, which you get that same Medicaid but with a check. But with SSI, the parent's income also counts. So a lot of times kids aren't eligible for SSI because the parents make too much money. Our Kids B, you can't have health insurance with it. The income limit's higher, but it also doesn't cover therapies like Our Kids A and TEFRA would, or the SSI Medicaid. TEFRA is based solely on the child's income, bank accounts, and their disability. The only time we look at the parent is when we're determining your premium. So we'll get into that. So TEFRA is until it shuts off the day before they turn 19. So after that, you could get SSI because when they turn 18, the parent's income doesn't count anymore. So that's something to transition to when they start getting closer. I don't know what the age limits are. Any school kids yet? Or this all, you have some school age children? Okay. My daughter's in the junior high. She is in the self-contained classroom, so we've fought the IEP war and the school district wars, and we've had good and bad, and so that'll be something fun to look forward to. And I gave you a map that gives the contacts. Sue Parks will be doing all TEFRA for Area 3. Pulaski County is Verna Brooks, and she does, I think she does all of Pulaski. But all of that will be going to her. Sue has been with the state for 33 years. So
she's nice, I know her.
Yeah, she is a super nice lady, and she will work with you if you call her, if you need an extension. My kid was in the hospital. I just got home and found this in the mail. She will work with you if you call her. So she is a very, very nice lady. Now the TEFRA program, I don't know if you guys know this, but in the beginning when TEFRA was set up, it was to keep kids out of institutions. It was to keep the kids at home because way back when TEFRA was set up, you didn't have resources to keep your children at home. Now, with kids within the autism spectrum, you're thinking, well, they probably wouldn't be in an institution even if we didn't have TEFRA. But when TEFRA was set up, autism wasn't here. So they've made allowances for the autism spectrum, and they're looking at functionability and daily living. You know, can this child function without the Medicaid, or do they need to have this extra help? And that's kind of what they look at, because they're going to look at the disability. And a lot of parents don't want their kids to be disabled. They don't want that label. But you have to have the label to get the Medicaid. You have to have the label to get the services. It has to sound bad to keep the services. You know, you always go, oh, well, they're doing so great, and well, if they keep doing really great, they're not going to have Medicaid anymore. So you can make, you know, you don't want to sugarcoat how well your child's doing. be realistic, be accurate, and if they do get so much better they don't need it, fabulous, that's great. But don't fake it, you know what I'm saying? Because a lot of parents, they're still in denial about their child. And they have a hard time saying, oh, yeah, they do need services. My child has some delays, but they're not disabled. Well, they are, according to Social Security, because whatever their delay or disability is impeding on their daily living. Can they function at school? Can they do things by themselves that other children can do? That's what they're going to look at. So I always tell people to make it sound a little bit worse than it actually is. Don't lie.
I have a question about that. With autism, wouldn't it just be really easy to just say he's not functioning at his age level?
Well, they're going to look at more than that. They're going to look at your evaluations to see how far delayed he is. I haven't seen many kids with autism that are denied. Some of them improve with time and they don't need it anymore. So it really depends how functioning they are.
Well, I guess my question would be, I have an 8-year-old.
Mm-hmm.
He's, functional at like a 4-year-old level.
Yeah,
they wouldn't look at that level and say, oh, well, he's okay.
No, they're going to look at his age. What should he be doing at this age? Okay, he's only functioning at a 4-year-old level. Like my daughter's 13. She functions maybe at a 1-year-old level. So, there's some significant delay there. They're not going to be able to go do the things the other 8th graders are doing because of communication or not being able to participate like the other kids do. One of my friends has a son that has autism, and he is significantly delayed because he is nonverbal. And he tries sign language, and they're working on it, but he's maybe a year or two younger than Samantha, and it will never be an issue because he's going to be significant. So they look at that. I don't know the exact rules and guidelines because what happens is it goes to the medical review team, and they're in Little Rock, and they're going to look at the definition of a disability. They're going to look at all the records that are provided, and they're going to make that decision.
Okay.
So, let's see. So the front page, the TEFRA waiver page, kind of gives you an explanation of what the program is about. And like I said, you see the institutionalized thing, just keep in mind that, way back when, before autism was coming up, you had children like my daughter who's in a wheelchair who, she's never going to be able to be by herself. Back then, she would have been put in an institution because there would have been no way to care for her at home. So they created this Medicaid for that purpose, to keep the children at home. It's cheaper for them to keep the children at home. And it's better for the children to be at home, and then it also helps them be in the community with other people. So basically that's the purpose of the Medicaid. And on the back of that it shows the premiums. The reason why you pay premiums on TEFRA is because TEFRA is a waiver program, and that means that the state does not have to have it. They have opted to provide this Medicaid to the people in Arkansas. And at one time, they were going to discontinue the TEFRA program because it cost too much. Well, they came up with the premiums to offset the cost so they could continue with the program. Enough parents complained that they needed it too much, and this was their solution. Now, if you have health insurance and you don't know about paying another premium, the best way to look at it is, how much therapy are you getting? How much medicine are you taking? Is there equipment needed? That regular health insurance is not going to pay. Health insurance will not provide a wheelchair like my daughter has to have. Medicaid will pay that. It's once a year, and they'll look at major equipment or needs. My daughter's seizure medicine is $1,000 a month. That's one pill, you know. So there's no way we would make it without her Medicaid.
Okay, so this is where a lot of my questions are going to come in.
Okay.
Because we've been on it for almost 3 months now. Where the little things like the therapeutic listening stuff that he needs, is this something that the TEFRA will cover? That the therapist has said he needs this, you know, you need to get this. Are they going to cover that? The occupational therapy tools, the oral stimulation stuff, is that stuff that it would cover? Because these are the things that we need.
Yeah.
That
they're going to look at some stuff they will pay for and some stuff they won't. Like we could get a wheelchair, we've gotten a stander, we've gotten shower chairs, you can get a car seat, but they only allow for certain things. So you could call to Medicaid and ask for utilization review, and they will tell you whether that's something that they would consider paying for.
So I call them.
Yeah, call the number on the back of your card and tell them you'd like to speak to someone in utilization review. And they will tell you if that's something that they might pay for. Because generally you will need a prescription and maybe a letter of medical necessity for that to get that covered. Maybe
If this
go
helps, my daughter's on Medicaid, and they wouldn't cover anything that had to do with like oral stimulation or anything like that. But that was Medicaid, which is the same thing.
Yeah.
But I will say, I think that they do review those things because, like with the prescription, like TEFRA has covered my son's like Theratogs and his AFOs and some of his therapeutic listening. So
Right.
I think
Well,
it's in the necessity.
Yeah.
Like that his therapist is saying, like the weighted vest, and I mean we've paid already for the weighted blanket and the toys and all that kind of stuff, and it's like this is all stuff that his therapies are saying that he needs, and this is the stuff that we're having to to pay for, and this is the stuff that is therapy for him, but this is the stuff that we would think that medically we would be getting the money for.
Well, I'm wondering though if your occupational therapist put him on like an official sensory diet with an official prescription that he needs to do these things at these intervals.
Right. This is his official, this is his sensory diet with the brush and the weighted blanket and the weighted vest and everything, but we're expected to come out of our pocket and pay for it all.
Is it not being provided at school?
That's a whole nother story.
What district are you
He's in Pulaski County.
in? If the occupational therapist says he's supposed to get it at school, you can find it.
They're not allowing us to have an IEP right now.
Yeah, they can
We've
do
had
that.
several meetings and they're still denying. We've had even letters from his doctors at Dentist Developmental Center, and they're still saying.
You need to file a thing
Absolutely.
with circuit.
Yes.
Call Jenny Dunn, the head of special education. If you run into a problem with Pulaski County,
They know
call
that
Jenny
Pulaski
Dunn.
County's trouble, don't worry. They know. Yeah, they know. I've taught in Pulaski County, that's one of the reasons I left.
Meeting after
Yeah.
meeting.
No,
Just-
you need to call the state.
Call Jenny Dunn.
Call the state.
I promise you, call Jenny Dunn.
That is.
Call the state, because if the OT
She's the
needs to be
director of the special education program.
your child should be able to get what they need at school.
Yeah, you'll have state education people crawling all over them. and-
Absolutely.
Well, the OT at the school gave him a weighted vest, and she gave it to his chair, but there was no supervision in the classroom for it. And so I told him to take it out, because if you give him a weighted vest, but nobody's supervising how long it's on him and how long it's off of him, then that's doing more damage.
Is he in a self-contained classroom or
He's in a regular.
regular? Yeah, he needs either an IEP or a 504.
Yeah, that doesn't mean you can't have an IEP.
Yeah.
It's not been fun.
Yeah. Yeah.
No, you need to fight. Call the state and start fighting. 'Cause
Yeah.
they should be providing that stuff at school. If he gets OT, he should get it at school.
Mhm.
That's kind of what we thought, but they're not
Start calling.
Yeah, because I know regular Medicaid, which is what TEFRA is, they won't pay for a lot of the little stuff. You know, like a wheelchair is every 5 years, and a stander is every 5 years, and you know I know they do the big stuff. I'm not sure about the little things, but you can call and ask to talk to utilization review, and they'll tell you if that's something that they would pay for or not. But I would definitely contact special ed, and there's a circuit that I forget what it stands for, but
I don't remember it either.
there's a form you can fill out for circuit, and they will investigate the school and find out why they're not doing what they're supposed to be doing.
And the
If
schools
you just
jump
Google,
when they get a call from circuit. They get moving fast.
Yeah.
if you just Google Department of Education circuit report, all capital letters, you'll find the link to get there.
A lot of that parent advisory council that I belong, we have a website. I think it's PAC for Arkansas, PAC. We have a lot of links to that stuff on our website. So that might be a good resource for you too. So, and Right Law, have you heard of Right Law?
Been on there.
Yeah, I've been to 2 of their presentations, and if you can get a chance next time they come to go to that, they're pretty awesome. The books are awesome too.
Okay, just back to like on our premiums where we're at.
Yes.
How often do they review, or like if you get a job change or something, how does it change on what your monthly premium is on?
Well, generally we review it at reevaluation, and however, you can change. Policy says you can change it every 6 months, but if you call Sue and say, you know what, my husband lost his job, we don't have this income anymore, you know, this is what we have, can you adjust it? She probably will. If you provide her some verification that the job is gone, she can adjust that. But for the premiums, it is so important to turn them in on time. And if you get a payment selection form, when you first set up, you get a form to decide how you want to pay, and they ask for the first 2 months of your premium. If that's not turned in, your case will close. And we send you several notices to get you to pay the bill. A lot of people, I'll send a check and not the form. Well, we're going to close your case if you don't send in the form, because that's part of it. So if you get any mail, it's important to return it as soon as you can. And premiums, we're going to look at your tax return. And on one form it's line 22, another one is line 15.
Okay. I have tons of questions about that. My husband's military. What military pay, I mean, is it just going to go strictly off the IRS form, what the taxable income is?
We're going to look at your last tax return, and we're going to look at one of those, depending on the form, it'll be one of those lines.
Okay.
And then we subtract $600 off for each child. And then if you have any medical deductions that you've itemized on your tax return, that also gets subtracted off. And whatever that comes up to, we plug in the computer, and the computer will determine what the exact premium is.
Okay.
So it's whatever's on the tax return, unless you say, okay, he's not working there anymore, you know, this is our income, it's not representative anymore.
Okay, so but like military housing allowance, basic allowance for substance, none of that would be part of it? Okay.
We're just going to look at those lines,
Okay.
because that's what the policy specifically says too. And
Okay.
so, but it's the importance of doing things on time is huge. If you get your reevaluation in the mail, see what the day is due. I do my stuff the day I get it. It's in the mail the next day. It doesn't get lost. It doesn't get set in this pile. I can't risk losing my child's Medicaid. And that's what's going to happen. If we don't get your stuff back and we don't hear from you, it's going to close. It's not, you know, unless your child's in the hospital or, you know, a family member passed away and you're in California, we can work with things like that because that's the nature of having children with special needs. But it's Thanksgiving next week, and can I give it to you in a couple weeks? No. Do it right now. Mail it in. The forms are super easy now. They used to be awful because they were nursing home forms that we were using. But now we have these forms in here. And a lot of these seem intimidating, and I know people are scared of forms, but, and I do this all day, so they don't care. So first, there's instructions. It tells you what we need, and this is the initial one. It's got Sue's address on it if you need to mail anything to her. But this notice here that's got the 3 different categories, that's just to let you know that, you know, with your privacy information, it's initial it, send it in. That's all you have to do, to initial it and fill out your address, you're done. The application, this is also for the autism waiver, but we cannot take the autism waiver applications. Those go straight to partners, and we'll talk about autism a little bit later, if you haven't heard of it.
My daughter has cerebral palsy, so I don't have to fill that out here.
Yeah, you would, this, for the TEFRA, yeah, you still have to fill this out. It's the same form for both programs. So, the reevaluation form is a little bit different, but it's very similar to this. So, and it's all for the child. TEFRA is all about your child. It has nothing to do with you. We don't want to know about your income except for the premiums. We just want your tax return. So you fill out stuff for your child. Does your child get any kind of income? Yes, some children do have income when they're 3, and they get Social Security off their parents. Maybe they get child support. That income has to be reported. And the income limit is like $2,100 a month. It's 3 times the SSI limit, which is $710. So that's what, $2,130. So most of the time, most kids aren't going to make that much money. So income's not usually an issue, but you have to report it. Resources. Yes, children who are 3-year-olds have resources. They have savings accounts that grandma set up. They have savings bonds that somebody bought for birthday or Christmas. That stuff has to be reported. When you turn in your application or a reevaluation, you might as well tack it on there because we're going to ask for it. It's considered a resource. You can only have $2,000 in resources. So if you have a savings account for your child and it's getting close to $2,000, take it out. Put it in an account without your child's name on it. Don't, it's, while you have Medicaid, I wouldn't even put your kid's name on it. There's no transfer penalties with TEFRA, but if you go over $2,000, we're going to shut your Medicaid off because you're over the resource limit. If you're doing a college fund, put your name on it. Do not put your child's name on it unless you want to start taking money out and get that letter saying we're going to close your Medicaid. Okay? Savings bonds take forever to mature anyway, so they're not just a huge issue, but I've run into several bank accounts where they've had to yank some money out to stay eligible. Okay, health insurance. If you have health insurance, you cannot drop it unless you are fired or your employer stops your insurance. If you drop your insurance because you decided it's too expensive, you are not eligible for TEFRA Medicaid for 6 months. So once you have it, you cannot get rid of it voluntarily.
But if you change jobs and change insurance, that's different, right?
Yes. Now, you lose your job, change employer, anything like that. We just need to know when that happens because Little Rock keeps track of the Medicaid, insurance for the Medicaid. We don't have access to it, and we have to let them know because when you go to get a prescription for your child and it shows you still have insurance, you're not going to be able to get your prescription because it's all messed up. So if your insurance for some reason stops, you need to let your worker know so that they can get it taken out of the computer. Did you have a question?
I just want to ask about the TEFRA. My son is on exercise Medicaid. I don't know really what we're staying with TEFRA. So does he have to be on my insurance in order to qualify for TEFRA?
No. They don't have to have insurance to have Medicaid, but if you have it, it's existing when you get approved for the TEFRA. You cannot get rid of it because it's too expensive.
So that's whether he's on it or not. I still have to keep it for myself.
You could, yeah.
Okay.
You just can't say, oh, well, we have TEFRA now. I'm not going to have health insurance because I don't want to pay that other premium. You can't do that. unless you want to be without insurance for 6 months, and then we can set you back up after the 6 months. Only if you lose your job or the employer stops carrying the insurance for some reason, but to do it voluntarily, that's a big no-no.
Could you clarify what Our Kids is? Is that the same thing or is it different?
Our Kids A is typically, it's the same Medicaid as TEFRA. I've heard some people say you get a little bit more stuff with TEFRA because it is for disabled children. I've not heard verification of that.
Okay, so Our Kids is different.
Yeah,
It's more
in my mind, Our
need-based.
Kids A, it's based on your parents' income, it's based on the child's income, there's no resources, there's no premium.
Right.
Our Kids B is a higher income limit, but you can't have health insurance and it doesn't pay for certain therapies.
Okay.
So if they switch you to B and you've been getting therapy or day hab at your child's getting daycare paid by Medicaid, it's not going to pay that and you're going to want to get on TEFRA.
And TEFRA is specifically more for disabled children.
Yes, and it doesn't count the parent's income. And that's where a lot of the trouble comes in. So, because you start making money, but it's not enough to really pay for all these expenses, but you make too much to be eligible for the good programs. Well, TEFRA comes in and helps. So.
And I have one other question too about the renewal. I did the renewal and I think everything was fine. Is there any way to confirm, or are we being a pain if you try to call to make sure you got the paperwork? Because that was a concern I had. I mean, it seems like everything's fine because now that was 2 months ago, but
if you don't hear anything, it's
good news. Okay, that's kind of what I figured, but
yeah, but you can call your worker and ask her, did you need anything else?
Okay.
Because I've found that TEFRA parents are double checkers. And verifiers and make
They've worked
sure.
with SSI.
Yes, yes. And I asked somebody, I said, "Am I like that?" And they're like, "No, you're a pain." Because I'm very.
but you kind of have to be from the beginning.
Yes, because it's important stuff. I mean, this is, from like my daughter. If we didn't have this,
How do
I don't
you
know
make
what
it
we
happen?
do. Yeah. So it. And a lot of people, they set stuff aside, they don't do it right away. And then they're like, "Why'd you close it down?" And I'm like, "You didn't turn in your stuff."
Yeah.
Well, what are we supposed to do? Keep track of your stuff. It's important. It's like your electric bill. It's that important to have electricity. It's that important to have your water bill and you pay your mortgage, and it's that important if it's paying for stuff like prescriptions and therapies. And my daughter gets Pediasure and diapers, and I mean, that's a lot of stuff that we wouldn't have if I didn't make sure I was on top of my game.
So what happens if it does get shut down?
You have to reapply.
You reapply and then it'll go through however long. What's the going time frame
Well,
on processing?
If it's just we have 45 days to work an application. It could take longer if it has to go through the medical review team. If your child has not had SSI or disability determination through Medicaid before, we have to do that process before it can be approved. And that can take 3 to 6 months.
My daughter has SSI right now, but we're going to lose it because my husband got a new job. Can I still apply for this while I'm on that? Because they told me that.
Well, how soon is it going to be closed?
Probably within the next 2 months.
I would wait when you get the exact letter.
See, I'm just kind of ignoring them right now because they haven't contacted me to send in a check stub yet. So I'm just kind of ignoring them at the moment.
Yeah,
until
I would
next
do
month.
it probably maybe a month before it's going to close.
Okay.
Because we won't have to do the disability determination, but you'll have to do some TEFRA paperwork, and I forgot to bring those. I was just all crazy.
I'm from Clinton anyway. I'll just burn down.
Ask Sue, she'll tell you what. Because if you're brand new and you haven't ever had any SSI, and you've never had any kind of Medicaid for your child before, we have 2 people that have to look at your child's history. We have the medical review team, and they're going to determine if your child is disabled, and that's the longest part of it. They're going to request medical records, and they're going to look at the definition of disability by Social Security and determine if your child is eligible. To speed up the process, if you provide any evaluations, IEPs, goals, any medical records you can get your hands on and turn that in, will speed up the process. Right now, they're about 5 and 6 months out to make that determination.
I've got a question on that. What is the determination of a disability? I mean,
I
what,
should have printed it out.
I mean, I know that I'm a therapist and I've tried to get some of my kids on TEFRA, but my understanding is they have to have a disability in 2 areas
Yeah.
instead of just one, like autism. I guess when you keep saying that, I guess I'm, because if they have a disability, but I've been denied because they have to have it in 2 areas. Is that right? Or how do you?
I've heard that too. I'm not sure what their exact guidelines are. Now, the TEFRA committee and the MRT are 2 different things. The medical review team is going to determine the disability, and they're going to look at, daily living. If you look at the form, it's a 6-page form, and I didn't bring it with me, that you have to fill out and answer questions about your child, and that's where you need to be honest. And they kind of look your daily living. How does your child's disability affect their daily functioning at school, or playing with others? They're going to look at that. And I know if they need therapy in 2 areas, I've heard that that's qualifying.
That will qualify.
So just a speech delay is probably not going to
But it's not going to qualify if it's just one area.
My understanding is that, you do probably know better,
You do.
but there's speech, OT, PT, and then developmental, those
Right.
4 areas, but
Right.
they have to qualify for 2.
Right.
So if it's speech and developmental,
Right.
they can be okay, but if it's not
But
2, just
once-
like you said.
Right, and that'll qualify them, but when they turn 3, that developmental drops, so they can't have TEFRA
Right.
because they will have dropped a developmental, so that would still be one area.
I do think that it has a lot more to do with severity level, because we did not have an official diagnosis and we were accepted for TEFRA, but it was like we need, usually developmental, that might show that they need OT or PT with speech. I think it's not so much they have cerebral palsy or they have this as much as it is like if the severity level shows and dictates it. So I think that's what you're saying on that. If daily living, you can say Johnny is 4, but he is not potty trained. He cannot dress himself. He cannot be left alone.
He can't brush his teeth.
It's more on what you depict on there on where.
When they go to school, they have to help him read and help him answer his questions, and he requires full assistance or some assistance. They're going to look at that.
So there's no firm to
There's not a guideline that we can look at and go, yes, fill all this paperwork out because probably you're going to qualify, or hey, fill all this paperwork out and try and you're going to get denied. There's no, okay.
Can or does Sue give advice to parents on that either? Just save parents time, like, hey, Sally has sensory processing disorder and it is really affecting, she's getting OT. Would she even recommend, or is it more so just a?
We have no training for this. We are not trained in the medical part, so it's hard to say, what it is. I've seen kids with diabetes be denied because it's a medical condition. It's not really a disability. That's what they said. So they're looking at how it affects the daily life, but no, I've asked questions to try to figure it out, and the nurses up there do it, and the doctor looks at it, and it's all up in Little Rock's hands.
It's been really easy. My daughter is a few years older than my son, so that's kind of what I do. I think back in my mind, when she was 8, what was she able to functionally do?
Well, a lot of my kids that I see, and we've done this for years, that I know now how I can qualify them to get them TEFRA, but a lot of my kids can function properly. They just can't speak, and they cannot communicate properly. And they don't see that as anything,
But
like they can't dress themselves. And I guess that's where I'm
But if
kind
they
of,
can't speak, they can't socially interact at an
Right.
age-appropriate level.
but I have to still get them in 2 areas.
Well, social and
That's-
speech, aren't those 2 different areas?
Well,
Social,
not
no.
medical.
No.
I think it probably would depend on the severity.
Even if I have severe kids, they still won't
still have-
qualify unless I have that second therapy with it.
Yeah, and it's based off federal guidelines, that's what we have to follow.
That's what I'm wondering, if there
Yeah.
is some type of a guideline that us as therapists, can have an understanding of, instead of going to these parents and saying, hey, there's TEFRA out there, yay, let's try this, and then they'll get denied after even though we know their child, they need that extra.
I can ask, I've never seen anything that says what it is, but I'll see if I can't find out and I can let Courtney know.
Thank you.
Now the TEFRA paperwork, TEFRA committee actually determines if the child qualifies for the program with cost effectiveness. Is this child, basically, if they didn't have this Medicaid, would they be in an institution, or would they not be able to stay at home? And I know with autism, a lot of the kids would probably still be at home, but that's kind of their guidelines that they're looking at. That form has to be filled out by the doctor. It has to have the diagnosis. It needs to be complete. Some doctors, of course, they say that you're not supposed to fill out the form, but some doctors prefer that you do, because it's usually your pediatrician, and I don't know about you, but I see him maybe twice a year because I'm at Children's all the time. So he don't know my kid, what she's been doing, so I fill it out, he signs it, life goes on. So make sure your paperwork has a diagnosis on it, because they'll shoot it back, or even they've closed a case because the form wasn't complete. So some doctors make you go in to have the form filled out. Some doctors just want it and they sign it and you move on. But that form will be done every year, no matter what. Yeah.
Does it have to be your primary care physician?
They say that's who's supposed to fill it out, but I would give it to the doctor who knows the child the best.
Okay, because my primary care physician thinks my daughter doesn't have autism, and Dennis Developmental says, yes, she does.
If you can get them to fill it out in a timely manner, because we do send out these
She just went to
forms.
medical school, that's all.
Yeah.
Trust me, that's all they do for us.
Like, really? Okay.
These forms are sent out early on purpose so that you have time to get the doctor to fill it out. So if you have to send it to Children's, some of them fill it out, some of them
Well, she might do it. I haven't really pushed on the subject.
Yeah. If you can get Dennis to fill it out, that's good.
Okay.
Whoever you can get it to fill out the most accurate,
Okay.
that's the
Just
best.
get an MD to sign it.
Yeah.
Sounds like a medical doctor. Okay.
Yeah.
I kind of forget if a family applies and is denied, does it say on the letter, and I know it has information, if it was denied more by the TEFRA committee or if it was the medical review team? Like, so they know on what basis maybe?
It'll usually, with the medical review team, it'll say they determine not disabled or not disabled because they've improved. That's usually the medical review team. A couple of the ones I got back from TEFRA said that there was no clear diagnosis, no clear disabling condition. That's why the diagnosis on the form is important, because if they don't have that and they can't tell what's wrong with the child, they can't make an evaluation.
My little girl has it's a clinical diagnosis of cerebral palsy. It's not she doesn't have any evidence that she has it as far as like the MRIs go. Well, they look at that and deny. I mean, she gets all 3 therapies, so.
Yeah, she'd probably be okay.
And she's in a wheelchair.
Yeah.
She don't fall.
Yeah. Yeah, like Samantha, she falls under the cerebral palsy blanket, but she has a chromosome deletion.
They tested mine for everything under the sun, and they're like, if you want to see a perfectly healthy kid, there you go. And I was like, everything's come back perfect. It's very aggravating.
Yeah.
Did you say she doesn't qualify?
She does. Well, I don't know. She has Medicaid right now, so SSI Medicaid.
Well, the SSI automatically qualifies her, when
She
you
qualified
apply.
with them within 3 weeks.
Yeah, so then they would just do, they might reevaluate her medically in a year. But TEFRA is done every year. Now, MRT, it varies. Sometimes they review it every year, sometimes it's every couple years, sometimes it's permanent, depending. And that's why it falls at different times. You get paperwork from us, last month, and you've got a new thing for here. Well, it's because MRT made a decision 6 months after your approval date. Well, your reval's due at your approval date, MRT's done 6 months later, TEFRA committee might have got done faster, so theirs is due at a different date. So we've got 3 different time frames worked in, and so that's why it seems like a lot of paperwork.
MRT is a medical review team.
Yeah.
So like when I did my renewal in November, I still might get notice in a few months that the medical review team has looked at it and decided that.
Well, they'll send you that little packet of 6 pages to have you fill out, and then we send that to them.
I think that's what I did in November, like with
Okay.
the physician's assessment and everything.
Yeah. So they might come at different times because they all work at different time frames. TEFRA committee's pretty fast. They'll do it within a month. MRT is up to 6 months. So the due dates are all different, and we're touching the case all these different times, and I don't know, a lot of people complain about it, and there's nothing we can do to fix that. We try to send out the forms early enough that maybe it's not so bad, but when they get there, if you don't send the records with that paperwork, they have to request the records from the doctor's office, so that takes time to get the doctor's office to send their paperwork back, and then it has to go to the doctor, and he is doing the whole state. They do everybody. So that's why it takes so long, because they do the whole state and they're asking for stuff. So if you can send it with it, it's going to be quicker.
Then yearly, you'll do the whole application process again?
Yeah, it'll be similar to this one sheet. We'll ask for your tax return, verification of any bank accounts. And if we need that stuff, the TEFRA review team or the medical review team, we'll send that with it, or we'll send it beforehand so we can get it started. So maybe we'll have it back before your reval is due and try to get it back on the same date. But
There's not any lapse in coverage while we're waiting for it.
because it's not your fault.
And is it still accurate that once you are approved, you send in your application on March 1st, once you are approved, even if it's a while later, it will backdate bills for 3 months? I don't know if everybody knows that, so then
Yeah,
from January 1st to...
yeah, pretty much all of them. Now, if your case was closed because you didn't turn something in or your premiums lapsed, it may not go back to cover time because that wasn't our fault. So that may not go back. That'll be up to Sue to decide whether she's going to go back and cover those medical bills for you. So.
Question about that too. So I'm running into a little bit of a problem with that because we're supposed to be backdated 3 months. And my son actually had surgery during that period. And I've spoken with the center that he had surgery at and talked to them about it, and they're not wanting to comply. They've said, that we need to get the order to get the referral ordered, but that any money that I've paid or anything like that is not coming back to me, that is money that I've paid and it's done. And I said that is...
And they billed Medicaid and got paid for it too?
That they said they will be billing Medicaid that for the remainder of the balance, but any money that I've paid is money that's already been paid. And I was under the understanding that once I get the referral to them, that they should be crediting me back the money that I've already paid for that, because that was within that 3-month period.
That would be good business. Ethically correct to do that, yes. Well, if they bill Medicaid and they get paid for money you've already paid them, I would talk to Medicaid fraud about that. Because they're getting paid twice for...
So that is what, because Medicaid is going to pay them for that 3 months. Okay.
They might be saying, but we're not gonna bill Medicaid for that portion that you've already paid.
Yeah.
We're gonna deduct that from the bill.
Right, so I should just check and see
I
and
don't know
make
if
sure
they
that
can do that or not.
yeah.
I thought Medicaid had a set amount they paid for certain services, and it's black and white, there's no gray.
Yeah, so, and that may be what they're trying to do. They're trying to recoup what they know Medicaid's going to take off of that, whatever their schedule is to pay for that procedure. So, yeah, I would check, tell them you want it itemized and how it works, and how much did Medicaid pay, and yeah, I would check on that. Because I've heard a lot about the Conway providers won't pay bill secondary. And I don't know that that's right. I've tried to find out. I may try again to find out about that.
I sometimes will just say, no, you need to use, is,
I know Dr.
Medi-
Cole's office wouldn't, I had Medicaid and insurance when I was pregnant, and he wouldn't take either one. He would take one, but not the other.
I don't think,
And I had to pay, and then Medicaid reimbursed me after. So, I don't know.
yeah, that's not right. I'm not confident. I've never heard of such a thing. They don't do that in Russellville.
I have a question, somewhat in that, we have TRICARE, so which one,
Your health insurance is always primary.
so TRICARE is primary no matter what, and then TEFRA would be supplemental?
Yeah.
Okay.
I know they don't want to fill out the paperwork that goes with it to do both, so that's why they won't fill TEFRA, is what I heard.
Okay, so then I would have to
Pay the
fill out the
bill.
paperwork with TEFRA myself, and then, okay.
Yeah, it's weird. I don't know why they do that. Period.
I have a question about the premiums. If we have more than one child that qualifies for TEFRA, is the premium per family or per child?
It's per family. So we'll add the kids all in one, and that, once you have that premium, it's for everybody.
Also, we have one child that's on medication that our insurance covers part of, but the rest of it is pretty expensive. Would TEFRA cover the rest of it, or do we have to?
No, Medicaid, the TEFRA will pick it up. Now, our fund third-party resource, that's just your health insurance. They just want to know, it looks like it's just, I don't know who made it up, it's not awful, but basically, they want the child's name up here. Everything is the child. And then if there's an absent parent, say you're a single parent and that parent provides some sort of the health insurance for your child, that's what would go there. But if you're not, if you're married and it's all good and they're your children, you'd ignore that. Insurance, they just want to know the name of the company. If you could provide a copy of the card if you haven't already, that's helpful. Don't worry about the benefits stuff. Type of policy, most of them are group because you have them through your employer. And then the case head policyholder is who actually has the insurance. If your husband has it through the military, his name's going to go here. Because they want to know who is holding the coverage. And in the back, you just list everybody that's covered and you sign it. So. The next paper is just your HIPAA policy. You just have to sign it and send it back. And one's for you and one's for us. Oh, she did put the TEFRA assessment on here. Awesome. Somebody else got it this morning. The very back page is the paper the doctor has to fill out. I didn't think it was on there, but it is. It's the physician assessment eligibility. This form will be required every year, no matter what. It's the medical review team that might be every other year, or depending on what they decide. So I would fill out the top part with your child's name, address, and then underneath it says primary diagnosis. You need to make sure that's filled out. That the doctor includes the ICD-9 code, or they write whatever the disability is. They have to fill that out. I think doctors hate filling out this form because it takes so much time, but that's what they get paid for. So, and then the rest of it, you know, like I said, it's up to you. If the doctor doesn't care if you fill it out, you know better than probably he does anyway. You know, whatever applies to your child, you need to check it off or write it on there. It needs to be filled out because the more the nurses have, you know, the better chance you're going to get approved, that they know the details of what's going on with your child. You know, and especially on the very back page, it's the social history. That stuff you can fill out because the doctor's not going to know that for sure. But you know, who takes care of your child? What do they do? Do they go to school? Do they go play soccer? Do they ride horses for therapy? You know, they need to know what's going on with that child and who's around, and make sure that doctor signs the back of this form. So, but I just remember to turn your stuff in on time, and if it can't be on time, call your caseworker, because if they hear from you, they'll give you more time. We understand doctors do not cooperate with our timelines, or kids get sick, or family members pass away, or something happens, but just because it's Thanksgiving or tomorrow's Easter, I don't want to fill it out right now. That's not going to work, because I have to do this too. My daughter's on the DDS waiver, and I do this every year. I call Social Security every month. I have case managers come to my house every month. I deal with therapists and teachers and IEPs and medical supply companies and staff, and it's ongoing job to take care of your child with special needs, and this is another important piece of it. I recommend getting a binder, because especially when they get into school, get a binder and make a copy of this and put it in there so you know what you filled out last time.
Do page sleeves, not trying to hole punch. It gets old real fast.
Yeah.
Have little slips in there.
I do the hole punch, but I have a book. I have one full binder just with IEP goals, evaluations, appointment letters, everything. So when I go to IEP, they're like, "Well, what do you mean?" And I thunk. I've got a big 4-inch binder with all my stuff saying, "Now tell me it's not there." And it'd be the same with this. You would have a copy of your stuff, and we didn't get it for some reason. It got tore up at the mail post office. Oh, I have a copy of it. Here, let me give it to you now. Here's my medical records for my child. I have it all in a binder. That helps, especially with school, because later on you're going to look through and say, these goals aren't working for me anymore, and see what the progress was, and you got it all in one place, and it'll just make your hectic life a whole lot easier, because it does get hectic. And
I have like the speech therapy evaluations, the OT every year. It's so much easier.
I'm on my second binder.
Yeah.
Because my first binder got so full. I'm a single parent. I work full time. I have a child who's 13 that's severely disabled. You have to have some sort of sanity in there somewhere to keep track of what's going on. And that's going to help you in the long run when you start going to school and dealing with IEPs and evaluations and all the crazy paperwork, because you think once a year is bad. When you get to school, the paperwork. So, and I don't know, have any of you heard about the autism waiver? It's,
how is it different?
It's the same Medicaid, but it provides behavioral therapies, and there's no premium, but there is an age limit. They have to be between the age of 18 months and 5 years, but if they get set up before the 5th year, they can keep it until they're 7.
Okay.
So you have to apply with
They have to
partners.
have autism too.
Yeah, this is specifically for.
Does if the person's on Medicaid, they can get the autism waiver as well?
We switch it. Like if you have TEFRA and you qualify for this, we're going to shut off the TEFRA and put you on the autism waiver.
Okay.
So when the autism waiver runs out, when they turn 7, you have to reapply for TEFRA.
Okay. Does it cover anything more than TEFRA will cover?
Just the behavioral therapy.
Just ABA?
Yeah, because regular Medicaid does not pay for those therapies. I don't know if you have that.
Yeah. I have a question about some of the,
Anybody else want one?
like the water therapy, horse therapy. Does TEFRA pay for stuff like that?
No, you have to have the DDS waiver for that.
Okay.
You know what that is?
No.
The DDS waiver is through the Division of Disabled Services. It's a kind of a respite program. There's a huge waiting list. It provides, it pays for someone to come out and take care of your child. Like I have staff at my house right now with my daughter. And they pay for equipment. that regular Medicaid won't pay for. House modifications for just making it accessible, vehicle modifications, but there is a waiting list.
What is the waiting list? Like years?
5 years now?
Yeah, it's years.
Oh my God.
So if your child is not going to be able to care
We'll
for,
probably move by the time.
because different states have different ones, they have different guidelines. Some don't have waiting lists, some don't have the program at all. But if you think your child's going to need assistance when they get older, they're not going to be able to care, like your child has cerebral palsy, eventually.
We're on it.
You're on
I
the
think
way?
we're on chapter 5 too. We have
Title
Brenda
V?
Squires, up to 7 with all that fun stuff.
Okay, so like, my daughter's never going to be able to be by herself. So this is a program that we got lucky enough to get on right before she went into kindergarten. Daycares don't take kids like my daughter, because she's got to be able to do what everybody else does. She can't do that.
Yeah, Clinton's not really excited about having to get a helper for her. She'll be in kindergarten next year.
Yeah.
They're not excited about it, so.
Well,
I told them they can get over it. They get money for it.
yeah.
It's not like it's gonna come out of their pocket.
Yeah, we've been fighting. My daughter doesn't have an aide, but she's in self-contained. So
There's, at Clinton, they'll get aids for them. I know another little girl that's up there, she has aids, so.
So that's what the DDS waivers for children that might not be able to care for themselves later on. There's some children who have autism that are very low functioning that would probably qualify for that. But there is like a 5-year waiting list, so if you think you're going to need it, you need to apply now and get on the waiting list so that maybe by the time they get out of high school, your number will come up. We got lucky. We got way lucky. But they have that, and then Children Medical Services have some programs that's based on funding, and that's through Brenda Squires, and she's in Faulkner County.
Will it only cover like one thing, or call it like a ramp, or will it cover, or will it cover more than one?
Well, it's based off money. You have $7,500 a year. So depending on how expensive it is, like we had our bathroom done, and of course that used up all our money for that year. And it's got to be under that amount, and it's got to be approved someone that will work with the state. They did our van. If we have a ramp on our van, they put a raised roof on it. I have a special bed for her so she doesn't roll off. They paid for that. Sometimes it's a fight because they don't want to pay for it.
With the beds, my little girl's still in her crib and she's getting probably paid for it. Where do I get one that she can?
Well, the one I have is called a safe bed, and you can probably Google it. And it's like a hospital bed, but it's wood, and the sides fold down. And they have some that are like hospital beds, and they have all kinds of stuff, and it's all very expensive. So. The one good thing about the autism waiver, if that's what you're interested in, there is no premium for that. So if you think your child's eligible and they meet the criteria and they're with the age limits,
You said if they got started at 5,
before their 5th birthday,
they could go until,
or
okay.
7. But you have to call partners. They're the ones that are administrating the program. We just approve it once they say it's okay. They still might have to go through the medical review team if they haven't had that done. And they're going to make you fill out all the paperwork again and do all this stuff.
Well, my nephew, I think he gets SSI and
Okay.
Medicaid.
He'd keep the SSI and we would tack that on to that.
Okay.
Yeah, the SSI wouldn't close. Only TEFRA would close if they got approved. SSI is a whole other animal.
TEFRA, it covers dental.
Mm-hmm.
So we have, well, this is another question. We have TRICARE dental, but like it won't cover to sedate them for a cleaning. He's not going to go sit in the doctor's chair and have a teeth cleaning. So TEFRA would cover that for us.
It should. You can call the 1-800 number on the back and
Okay.
talk to them. Call early in the morning, about 8:15.
Okay.
If you call later in the afternoon, you might be on hold for a while.
Okay.
So, but I'm pretty sure my daughter goes to Children's. They don't have to sedate her, but they pay for her to get her teeth done every 4 months.
Okay. And you said they pay for diapers and pull-ups?
If they're 3 years old, you can get diapers.
Okay.
And that's just with any Medicaid.
Okay.
You just have to have a prescription and contact a medical supply company.
Okay.
I personally use Finnegan's.
Okay.
They're fabulous people.
Okay.
Fake FedEx.
Yeah, ABC is good too. They can provide, like my daughter's on Pediasure, we couldn't use, they can only do Pediasure, they can't do the tubes with it. We use patient services for our Pediasure because they're qualified to do the tubes with it.
If they're under 5, you have to go through WIC.
Yeah.
Pediatrician. They won't-
Yeah,
they won't
once they
accept
turned,
it.
we had our pediatric through WIC, and then once she turned 5, we started getting it through the supply company. And you can use any medical supply company if they'll do it. You know, we used a local one for a while, and then they started slacking with our diapers, so we changed to a different provider.
You said any of those questions, there's an 800 number for
Yeah.
any specific little thing to
Yeah,
cover.
there's a 1-800 number on the back of your Medicaid card.
Okay.
You can call them, and they can answer any questions about specific procedures and coverages and things like that.
I have one other question. Oh, go ahead.
Oh, go ahead.
If the medical team was to decide, my son has autism and he's 4 and he's in the Center for Early Learning, and I'm excited by his progress, but I know he's still not nearly where he should be. But if they were at some point along the line to decide to stop his coverage, are there ways to fight it?
Mm-hmm.
And who do you go to do that?
You ask your caseworker for an appeal form, and we do a fair hearing. You fill out the appeal form, and it's real simple. You just say, I want to appeal the denial. And they'll set up a fair hearing, and there's a hearing officer in Little Rock who will call your local county office, unless you want to go to Little Rock. I had a parent who wanted them to actually see their child. When we do the phone, she'll ask questions, go over it, and decide whether they acted right or not, or if it should be reconsidered. I've had her overturn one MRT decision because they decided he wasn't disabled, and she overturned it.
I mean, when they do consider this, they are going to look at the last dentist developmental appointment and stuff like that, right? So they would have.
Well, yeah, as long as it's listed on the MRT form. But if you have your latest evaluation from them, you know, you could attach
Always
it.
include it.
Or, you know, if you haven't attached it and you think about it, you can give it to your worker and she'll forward it on to the medical review team.
Well, I know, like you were saying, with speech evaluations and stuff, that, you know, with autism it's so tricky because his speech is now improving a lot, but still he doesn't do it in meaningful ways. But, you know, I wonder at some point if he's going to pass some of those tests because, you know, I'm sure you know, because other people know.
You pass the test, and then some, like my daughter, she doesn't even register on the test where there's no progress, and they want to cut it off because there's no progress, and then they want to cut it off because there's too much progress, but it's not enough. It's crazy. I know. I feel your pain. But you can always appeal.
Okay.
You know, and if they decide against you, the next step is going to court. Most people don't ever do that. They usually just stop, and if something starts getting worse again, then you can reapply and with the new records if he starts to decline.
So is it, oh, I'm sorry, so is it just a year? You have to reapply every year?
Well, we reevaluate every year. The
Okay.
TEFRA committee is every year. MRT, they decide different times.
So what if you have TEFRA and you have it due to a disability, not like autism, but a speech disability with OT? And within that year, I retest and they don't qualify for speech. Then that drops their 2 to 1. So automatically they lose their TEFRA, right? Or does it keep going through that year till they reapply? I mean, they're going to lose it, right? That's what.
They'll keep it until we reevaluate it next time, because they're not going to ask for your stuff. Say like in 6 months, I approved you today.
Okay.
And in 6 months, say you test again and they've done better.
Okay.
nobody knows any different.
Really?
Yeah, because you're not going to know until they ask to reapply.
Even though we know, as a therapist, that parent knows that's not our responsibility to let TEFRA know to
Until
not
they reapply.
spend money
Privacy violation.
on,
You can't call anybody and tell them about your patients or your clients or whatever you call them.
Yeah.
but the parent can let them know.
Yeah, I would think most workers would be like, just wait until your next reevaluation.
Yeah.
And I think most parents would be able to say, well, he tested great now, but you want to solidify. And
Well,
Maybe
if
you had
we
a
know
good
for
day
a
that
fact, I guess I just see it as.
How often do you test? Yearly. See,
But
because
the-
once they hit public school, they probably only get it every 3
3
years.
years.
Right, right.
Oh.
But as my kids that I see that are,
Right, you see
you know,
younger
0 to
kids.
5,
Right, yeah, so they do
you know, I
every
test
year.
them every year. So
I would
if I just
test
tested a kid and said, sorry, you didn't qualify for speech, we have to stop seeing you, and their TEFRA reapply it until I can keep seeing that child.
Well, I mean.
You wouldn't as a therapist. If
That's
they
what I'm
check,
saying ethically, is that I
Well,
just can't feel
They
like
still
that.
keep their Medicaid, you might not want to bill for
Right.
services that are medically necessary.
therapy off.
But the other
but you
problem.
wouldn't as a therapist, if they test out of speech or they test out of OT, the therapy provider's not going to be treating them if they
They might
test
need
out.
that
Right.
Medicaid for something else, they might need it for
So that's the-
medicines or.
Yeah.
Family's
Other-
issue to deal with
Yeah.
from there.
Right, that's what I was
Yeah.
saying.
But my other,
with that
but the other thing
parent
is, yeah, go ahead.
feel the same way we feel.
Well, but the other problem is like with autism, I had a friend whose son at 4 tested out and he obviously still needed speech. Even the therapist couldn't believe she had to test him out of it because he has no meaningful communication, but he was passing all these things. Luckily, he's still qualified for PT and OT, but you know, so it's both, you know, yeah, there's the ethical that, but there's also the not all
Well, and I
parents
guess a lot of my
evaluate
kids,
correctly.
they don't need medicine, and they don't need a wheelchair, and they don't need this, so it's, I
These
guess.
are borderline cases of kids that need a little extra help,
Yeah.
and parents, it's expensive for them to afford intensive
Private
therapy.
therapy, right.
Right.
3
I've
times a
had
week.
parents call and say, I want to shut off my TEFRA because I don't need it anymore.
Okay.
And
Well,
we
and-
close it down, and I said, well, if something happens and you
So we need
it,
to, what I'm getting at, I guess, is we need to let those parents know they need to call. Because why pay a premium every month if we're not receiving services and if it's not helping?
If that's all
they
they
have-
were using it for, then that would make
Yes,
sense.
they're using it for they're using it for
Yeah.
therapy services.
Yeah, 'cause-
So we need to let that parent know, you need to call and get it shut off.
If
Or
they
you're
don't
gonna be
need it
paying a
anymore.
premium
Right.
for not coming, gotcha.
Yeah.
Okay.
They can still
I
use
need to know that. I kind of need to know what I need to do as far as TEFRA because I applied December of 2011 and it's been over a year and I have not got anything, but I have not went over the income guidelines for SSI. I'm always like right there on the mark, but I've never been, you know,
So you don't have SSI right now?
he does receive SSI and Medicaid, but I'm always borderline as far as the income guidelines for SSI.
You lose
And
it,
then
you get
next
back
month,
that month.
I think I'll be able to make like a couple of dollars, which they'll be terminated or inactive for that
Yeah.
month. So,
What you need to do, if you had SSI at the time you applied, they're gonna deny your application.
okay,
But like for my daughter, she's not eligible for SSI next month because we get 5 paychecks.
right. My
You
second
can
one.
apply for that 1 month. If you don't have a current TEFRA physician's assessment, that's all you have to fill out. And they will go back and cover that 1 month. But you have to reapply each time that happens. It doesn't automatically go back and switch to TEFRA for the months that you're not eligible. Now, I've had some parents that don't want SSI anymore because they don't want to mess with that twice a year that you're not eligible. You can tell SSI that you want to close your case, you don't want it anymore, and apply for TEFRA and just do that. Or if you're eligible for Our Kids A, switch to that. Okay. But you can do that as well, but like next month, you need to go ahead.
So
In
even if
April, actually it's May, we're not eligible.
Uh-huh.
So in April, you need to apply and say, they're not going to be eligible in May because of income, I need TEFRA for this month.
So, but would they not go back there 1 month and pick that up because the next month I'll be eligible? What's the point of going through the process when your next month would be back on track?
Well,
You get the help for the 1 month.
Yeah, you need the help, you have to apply, but once you have the physician's assessment in there, that's good for a year. So
Okay.
you just have to fill out that one application form, turn that in and say, I just need it for May because we're not gonna be eligible for SSI due to income.
Okay.
And they'll go back and pick up that month that SSI doesn't cover.
Okay.
And then maybe next year you'll have to do the physician's assessment form again to cover you the next year. But
So,
that's good for a year once we get it done.
okay, but once I do get approved, should I be receiving like yearly notices or something?
Because we're just setting you up for the 1 month.
Okay.
But you do need to reply because it doesn't sound like you never got an approval letter from when you did it in December of 11.
Okay.
Well, you wouldn't pay a premium because you're on the
No.
borderline.
Okay.
So
Yeah, you
so
wouldn't.
necessarily, you may even have it, you just don't know. Because you're not getting a premium payment.
No.
And there's no different, all you're doing is flipping category for that 1 month.
Okay.
Yeah.
You're flipping from SSI to, I was at the same spot, and my problem was, I'd go to the DHS office and I made them mad because they didn't want to do that, because they said by the time we enter this
That's what they
paperwork,
told me.
you're gonna be back on. But
Right.
you know whose problem that is? It's my problem, because if my son goes in the hospital that
Yeah.
month, then I'm responsible for that doctor bill because he don't have Medicaid. You tell them that. Because they don't like to do them.
We don't do the
cases.
premiums for that because premiums are always entered the next month.
Uh-huh.
So if I approve you Monday, which is April 1st, your premiums aren't going to start until May 1st. So if we're going back to do a month for you, we're not going to mess with it. So there are no premiums for those 2 months. But you do have to reapply for each time because it's like May and November. It's like it's
Twice a year.
It's twice a year that people either get paid 5 or 3 times a month, and that makes you ineligible for SSI.
Right.
So the first time you do it, you'll have to do this packet that I gave you and get the doctor's form filled out. You won't have to go through medical review team because you've already got your disability determination with SSI. And then next time, say later in the year, you'll just have to fill out the application, but you won't have to do the doctor's form.
Okay.
But next spring, you'll have to do another doctor's form. But there'll be no premium, and then if you lose your SSI permanently for some reason, then just apply for TEFRA again. We've got that disability determination. We'll have the physician form. You're good.
With this autism waiver, does it take as long to apply as it does for the TEFRA?
Well, if we have the disability determination in there already, so you already have TEFRA,
Well, I guess my question is,
it could,
I have a 9-year-old that was diagnosed a little over a year ago, and then I have a 4-year-old that we are just starting the process to get diagnosed. So she's already 4, she'll be 5 in November. So my
it could
question
take
is,
3 to 6 months because we would have to do the disability determination. Because they haven't had anything before. So, yeah, it could take 3 to 6 months, but we would go back, we would look at the time you applied, their age at what time they applied.
So once you apply, I mean, you're of course taking a gamble if you don't get approved, but once you apply, if you go ahead and start receiving services, once you're approved, it would go back and pay the 3 months.
TEFRA would, yeah. I'm not sure about the autism waiver. I think it starts the day we approve it, maybe.
Oh, okay.
I haven't done very many of those because it just started before I switched out of TEFRA.
The autism waiver though, that's not just for the ABA. It'll still cover like the dental and all of that
It's
as
whole
well.
medical plus the ABA.
Okay.
And there's the good thing about it is there's slots open.
Yeah.
There's only 100 slots in the whole state, and they have slots open for it.
And the
We
ladies
get
are
a-
super nice.
Yeah.
Yeah, we get ABA through the TRICARE, and ABA is fabulous. It's a lifesaver, literally.
I heard some of the time that they want to do the therapy is a lot.
Yeah.
'Cause I had one parent actually complain that it might be too much and too hard for the child to do all what they want you to do.
Yeah.
So, if you're not getting any or you want some more, we need people to talk to.
Okay, we have about 20 more minutes, so I want everybody to answer questions, but I would love for you to just say, this has been really helpful. I've learned several things. I thought I knew a lot, but I didn't, so that's good. What would you say are like maybe 2 of the top questions you get from parents, and what your answers would be regarding TEFRA, and/or like the top 2 things you think providers should know in serving the families they serve? Or
Most parents are nervous about if they're going to be reinstated, or if they're still going to qualify. They're really worried about that. It really depends on the child and their condition, and that's hard to answer. If it's a child like Samantha, there's not a question. People that are borderline, like a lot of the ones you deal with, that might be a little iffy. A lot of the forms and the money and whether they're going to get approved, that's the big stuff. So I just try to tell them, provide as much documentation as you can, turn your stuff in on time, and we'll do what we can. So for providers, they just need maybe help the people follow up. If they've applied, maybe check with them and say, oh, did you get a request for anything? Have you turned it in? It's really important that you do this, and maybe make sure they have their evaluations to send with their application, because that'll help speed it along too. So, but the deadlines are so important, because people blow them off, and then they don't know what to do because their stuff has been closed down, and they're freaking out because what am I going to do? Medicines, we're out of medicine. What are we going to do? Turn your stuff in, please turn it in. We want you to have it. We don't want to close you down, but we have rules we have to follow. And I know everybody has busy, crazy lives, and work and other children and soccer and everything. But if you sit down that night when you get it and fill it out and put it in the mail the next day, you are done and you don't have to worry about it. You're good to go. And you can call your worker and say, oh, I mailed that a couple days ago. Have you gotten it? Oh, good. Okay, great. I don't have to worry about it anymore. We will send you 2 10-day notices. And if we don't hear from you or not get it back, we're going to close your case. And the same goes for premiums. You're given 90 days, and we send you a 10-day notice, and if that money or that form's not returned, we're going to close your case. And you're going to go through that process all over again. So it is so important. Anything else?
The autism waivers, if you decide to, like I'm on TEFRA now, if I were to decide to go to autism waiver, that's only until 7. And
well,
so
the cutoff is 5.
Right, but if you qualified.
If you qualify and got approved, it's till 7.
And then what do you do after that? Can you reapply for TEFRA again? But the autism waiver does cover like being in the Center of Early Learning plus
yeah,
the
it's
ABA,
full
right?
Medicaid. It's what you have now with TEFRA, but you get the extra therapy.
and no premium.
And no premium. So I think they're
That's the same thing with if you're on TEFRA and you go to the home and community-based waiver, there's no premium. And this is something real important for the parents, even though Kristi says it's 5 years waiting list, and we sit here and we shake our head and say, oh my God, fill the paperwork out, because mysteriously if the legislature says Monday we're going to fund all them slots, guess what? If your paperwork's not sent in, you're not getting funded. And all that's changing anyway in the future. You may hear talk of community first options, and that's the thing the state's working on now. They've been working on it for 2 years, and it's all with the Affordable Health Care Act, but they're hoping to do away with that waiver waiting list. And so they really have no idea of how many people are even eligible for the home and community-based waiver, because there's people, as Kristi described, that gets that big packet of paper and they take it home and it gets put on the bar or on top of the refrigerator.
Right.
I got plenty of time. There's a 5-7 year waiting list, and you lose out. It happened the last time. There was a lawsuit about 5-7 years ago. There was a lawsuit against the state over the waiver waiting list, and they filled all those slots. Well, all those people that didn't have their thing, they didn't get on it. They're still, a lot of them are still on the waiting list today.
That program, that'll pay for respite care too, right?
Right.
Okay.
But regular TEFRA doesn't cover the rest of it. Okay.
Now, like I have someone that gets Samantha off the bus after school, and they stay with her when I run errands, like today when coming out in the rain. I have someone that the state will pay them through their provider, like we have Friendship, and they pay them to care for her, and they're trained to take care of her. And I have 2 people actually that do that. And during the
And they find
summertime,
someone for you. They don't leave you on your
they
own.
can,
They'll
or you
find-
can find your own people.
Okay.
I have found people who are friends or family of people that I know that I feel comfortable with them being there. So you know your child's being taken care of the way that they should be. So that's something that you think, you know, later on that you need to get on that waiting list. But I think that's how we got on ours so fast was they dropped a whole bunch of people because they didn't fill out that packet because they saw that
Is that in
packet one. Oh,
DDS? Is that what that?
DDS.
Yeah,
That's Brenda.
Brenda would help you, if you have a child, she would help you with that application and get it submitted. And how that process works is once you get that submitted into DDS and you have everything's done, and you're talking about they're real particular and your I's dotted and your T's crossed and all the signatures, but once you get that, what happens then is you get a letter and you're issued a number. And that number is where you're at on that. And what you can do is you can periodically call her and say, hey, where am I at? And she can look you up and tell you that, you know, and you should start going down. There for a while after they closed down Alexander Human Development Center, it was real stagnated and nobody moved for a while. But you'll see certain times that they'll start moving it faster than they usually do. The legislature only approves like 200 and something a year, like 240 a year, and they have to save a lot of those for like court cases, because if a judge tells a kid in foster care or something with special needs, that kid has to go on waiver, and they have to have a slot to be able to put them on. And so when it gets to be sometimes the end of the year, you'll see, you know, you'll hear of several people that's going on to the waiver program.
Ronnie, is it true, I was just at the family leadership training hearing, if you have a child that doesn't have one of those approved diagnoses for DDS waiver, did I hear correctly then that one of the kind of markers is like an IQ score of 70 or below?
Yeah. Yeah, it would be, if they didn't have one of the diagnoses.
But an intellectual disability or something
and
else
they
going
functioned
on.
as somebody who would, and usually that's by the IQ score of below 70, they would be eligible that way. And it was, a couple of years ago, it was added, spina bifida was added to that list. It wasn't on there. But how those kids got that before, a lot of those kids were eligible because they were under that score, and the lack of daily living skills. They look at that too.
Guys, do you guys have any other questions? Do you have anything else you want to add? And then maybe that'll give a few minutes for people to ask questions.
I don't think so. If you have any questions about your paperwork that you ever received, call your caseworker. They will help you.
And for you, I was in the same spot. I have a son that's 31 now, but I was in the same spot where you're at. And as Kristi said, when I got paid 5 times in a month, when I got paid weekly, or I got paid every 2 weeks, and there was that 3 times, they would always do that. And it's your responsibility to contact them. So I'd find out who that contact person is, and because it's your responsibility to let them know. They won't contact you.